Hello, I'm here with Dr. Melhem Solh, an expert in diffuse large B-cell lymphoma, or DLBCL. In this video, we'll discuss the study design and patient population in Lotus-2, the ZYNLONTA registrational trial that led to FDA approval. Dr. Solh, I'm sure our viewers are interested in learning about the Lotus-2 trial. Would you describe the study design?
Of course. Lotus-2 was a large, open-label, single-arm phase 2 study. In this study, we included 145 adult patients with relapsed or refractory diffuse large B-cell lymphoma who had received 2 or more prior systemic therapies. I'll talk more about the patient in just a moment. ZYNLONTA was administered as a single agent in 30-minute outpatient infusion every 3 weeks. The treatment was continued until progressive disease or unacceptable toxicity for up to 1 year. Now, the primary endpoint of the study was overall response rate, and the key secondary endpoints were duration of response and complete response.
Before you continue, I noticed the ZYNLONTA was given as a single agent. Is that meaningful for DLBCL treatment?
You know, as a physician, I can tell you that the notion of a single agent therapy is important considering these patients. Remember here we're talking about a third-line treatment, so patients have already endured multiple lines of therapy, which can typically involve multi-agent regimens. Being able to offer the simple dosing schedule of a single 30-minute outpatient infusion once every 3 weeks is definitely a meaningful component to me.
Yes, it makes a lot of sense. Now, what can you tell us about the types of patients who were permitted in the Lotus-2 study?
The study's inclusion and exclusion criteria are shown here.
I see. Is there anything about the patients who could be included that stands out to you?
Actually, yes. The Lotus-2 permitted the inclusion of patients who were transplant-eligible as well as patients who were transplant-ineligible. You can see from the trial it also permitted patients with high-risk tumor characteristics.
So that was the study design. Could you provide details about the patients who ultimately participated in the trial?
Certainly. Lotus-2 included a broad range of heavily pretreated patients with difficult-to-treat disease. The tables that you see on the screen present a select baseline patient and disease characteristics, prior therapies, and refractoriness to prior treatment. This patient population actually reflects the disease's heterogeneity. I'd like to point out a few things in particular that typically make treatment more challenging. For example, 14% of patients were 75 years or older, and the median age on the study was 66. Also, you can see that patients with potentially fast-growing and or aggressive forms of diffuse large B-cell lymphoma were included in the study as well. While the majority of patients who had diffuse large B-cell lymphoma not otherwise specified, 20% of patients had diffuse large B-cell lymphoma arising from a low-grade lymphoma, and 7% had high-grade B-cell lymphoma. In addition to it, the majority of Lotus-2 patients had refractory disease. 20% were refractory to their initial treatment, and 17% were refractory to all prior treatments. Those patients may have been chemo-insensitive. So if you took the overall study, 63% of patients in the trial had refractory disease.
Thanks for pointing out those specific characteristics. You mentioned in a previous chat that by third line, these patients have already been through a lot. We can see evidence of that.
Absolutely. These patients were heavily pretreated, more than half of them receiving anywhere from 3 to 7 prior lines of therapy, with a median number of lines of therapy prior to ZYNLONTA was 3. Some patients actually had undergone CAR T-cell therapy or a prior transplant, and most of them, 71% actually, had not responded to intensive chemotherapy. So clearly there is an extensive unmet need for patients who are ineligible for or who relapse after stem cell transplant or CAR T-cell therapy. It is very important to appreciate the types of patients in Lotus-2, including those with distinct treatment challenges, because it provides an important context for the results that we saw in this trial. Many patients achieved a meaningful response with ZYNLONTA as a single agent. You can learn about those responses in the video focused on Lotus-2 efficacy results.
That's right. Dr. Solh, thanks so much for sharing your time and expertise in this area. We hope you found this discussion informative. To see more of our discussion, please watch the other videos available in this series. For additional information, you can visit ZYNLONTAHCP.com or contact your ADC therapeutic sales representative. Now, please take a moment to view the important safety information for ZYNLONTA.